is Mr. Jones. Very good to see you today. Please do make yourself nice and comfortable there. Yes. Nothing crazy booked in today, but I do imagine that I will most likely be giving you a little bit of a clean, removing some plaque build-up on your teeth. That's typically what happens with most dental checkups. You know, people, even when they're absolutely on top of their dental hygiene game, they still have a little bit of plaque build-up. It's actually somewhat inevitable, you might say. So I probably will be doing a little bit of cleaning in your mouth today, but other than that, just a nice normal dental checkup. Nothing to worry about, okay? So let me get my gloves on. First things first. There we go. I'm all nice and comfortable now, and I think we should just dive right into it. Okay, if you're ready, if you'd like to just open your mouth and I'll begin the examination. Okay, if you're nice and comfortable, I'm just going to use my special little dental mirror here with the light. There we go, light is on, to look inside your mouth. Okay, so let's have a little browse, shall we? Have a little browse inside this mouth of yours. Interesting. I'm just going to have a very quick general observation to begin with. Have a look at the quality of your mouth. We're looking for any excessive redness or maybe swelling of the gums. From what I can see so far, everything looks quite good actually. Quite good indeed. We want you to be producing a nice amount of saliva. That's generally what keeps the pH of your mouth in a good balance and prevents too much bad bacteria from building up on your teeth, which leads to tooth decay. Okay, that's why smoking is so bad for your teeth, because it dries out your mouth. Okay, I'm very happy with what I'm seeing there so far. Let's take a look at these actual teeth, shall we? We'll begin with the top row here. Okay, so we've got 1, 2, 1, 2, 1, 1, 1, 3, 2, 1. Okay, just taking another little look here. Okay, on this side, 1, 2, 1, 2, 1, 2, 1, 1. It's like 1, 1, 3 as well. Okay, so far so good. Let me just type that up into the computer whilst I remember. incisors. That's a very common location for plaque to build up. Not only is it a difficult place to remember to brush quite thoroughly, but also it is generally where a lot of food residue ends up whilst you're eating. Okay, let me just double check the top as well. How are the top incisors looking at the back? On the back of them. Okay, a little bit of plaque build-up there as well. Not too much though, not too much. Not to call them dirty, you know what I mean. They're just a bit of plaque build-up, okay? Now, let me type up those before I forget. Now then, you're nice and comfortable. Are you ready for us to continue? Okay, good. The next thing I want to do is actually clean the backs of your teeth. Okay, the backs of your incisors there. As I mentioned, the bottom row, quite messy, quite a little bit of plaque build-up. So I'm going to use some basic little metal dental tools to scrape the plaque off the back of your incisors. Okay. Okay, let me just grab my tools now. Okay, so if you're ready, let's begin. I'm just going to be going towards the back side of your incisors here. Okay. Hopefully that doesn't feel too bad, does it? No, not too bad. I'm sure it's a bit of a strange sensation. I am using the metal tool to scrape the plaque off your teeth, okay? But from what I can see, your teeth look very strong, very well built up. Not much enamel erosion at all. So I'm guessing that you don't drink too many fizzy drinks, sugary drinks, do you? No. And maybe your diet is very rich in calcium and vitamin K2, is that right? I think so. Judging by the coloration of your teeth and their density, they look very good indeed. Very good indeed. If you do want to try and avoid getting this buildup of plaque in the future, the only thing I could really suggest is to try and improve your oral health hygiene routine generally, you know what I'm saying. So brush your teeth twice a day. Try and make sure that you do a thorough job. I would use a soft bristled brush. That's what I would recommend. And try not to get sort of stuck in these routines where you brush your teeth in the exact same way every single time, because that's going to end up in some of your teeth being clean and some of them being left unclean. Certain areas will lack attention if you get stuck in a sort of routine, you know what I'm saying? Yes. Of course, you could also floss. I would floss once a day, if you can remember. Very, very good for getting rid of any bacteria buildup between your teeth. We often forget about just how much ends up between our teeth. Can be quite as well. So personally, I would say that flossing is essential. Absolutely essential, personally. And then of course you could use mouthwash as well if you would like. Some of the mouthwashes, they can be a little bit harsh though. So I would be careful with that, and I certainly wouldn't overuse mouthwash. Perhaps just once a day is fine. There's also a few other things that you could do as well. You can chew xylitol gum. Xylitol is like a sugar substitute, and it has the unusual property of being very protective of your teeth and of the microbiome in your mouth. And some people have even said that they have reversed cavities whilst chewing xylitol gum. So that might be something to look into if you'd like, if you're interested. I actually buy it off Amazon, xylitol gum. You can get it quite cheap and quite pure as well, quite good ingredients, you know. Give me 1 second. I'm just going to have to use my little suction tool to remove some of the debris that I've loosened there. Okay, this might be a little bit loud, but not too bad, I think. Just going to be sucking up some of the loosened debris. It's likely going to make your mouth feel a bit dry as well, actually. Okay, because it is sucking up some of your saliva as well. Okay, very good. Just going nicely. Make sure that I get everything okay. I will need to go in your mouth again with the metal tools, but not for long now, not for long. I think we've got the majority of the plaque. Okay, this is good. Excellent. Okay, very good. Let me just use my dental mirror to see exactly how much I've cleaned up so far. Okay, so I'm going to be looking at the back of your incisors here. On the bottom. Oh, look at that. That's so much cleaner already. The difference is night and day. That is phenomenal. Absolutely phenomenal. Fantastic. There is a little bit left. I will attempt to remove that now. But honestly, even if I don't manage to remove that, that'll be fine. You'll have no problems from this, okay? And of course I'll see you again in 6 months' time, and we'll see how you're doing in terms of plaque build-up, if it's returned at all, okay? Okay. Right, let me just go back in there for a moment with the metal tools. See if I can get the last little bit of that plaque off for you, okay? Very good. There we go. Doing excellently, by the way. Very good job. So as I mentioned before, you could try using xylitol gum. Maybe chew it once a day or after meals. It will not only freshen your breath, but the xylitol will work wonders on keeping your teeth cavity free. Something else that people are getting more into recently is oil pulling. And that's basically putting a small amount of coconut oil in your mouth. It then melts, and you keep it in your mouth around your teeth. You sort of swish it around your teeth it's a natural antibacterial. So that will clean out your mouth of any nasty bacteria. And that should help prevent cavities. I believe there are studies showing its effective nature. It does work. So it is worth doing if you really want to increase your oral hygiene routine. There's also a couple of other things you can try as well. You can use a tongue scraper. Scrape your tongue once a day. You'll notice, depending on what you eat, you may have more or less white tongue coating in the morning. I think that's mostly a symptom of the state of your intestines. If you have regular bowels, then you shouldn't have too much white tongue build up in the morning. But if you are a little bit constipated and not going to regularly, then you may be more prone to experiencing the white tongue phenomenon. It can also just be a side effect of certain foods. If you're drinking a lot of milk, for example. But you can use a tongue scraper to clean your tongue. And you can also use a water pick to sort of blast water at your teeth. I think it can be quite harsh. Some of them are too powerful. But if you can get one with a soft setting, a low pressure setting, that could definitely be helpful. It's very similar to flossing. You can search water flosser, water pick. You'll find them online. And that does help indeed to keep your mouth nice and clean. Okay, there we go. Let me do the little suction thing once more, okay? Here we go, you ready? Same thing as before, I'm going to be making a little bit of noise. Just sucking up the plaque that I loosened off. And it's going to be sucking up some of your saliva as well, okay? So you might get a slightly dry mouth out of this. Okay, very good. Excellent, excellent, excellent. With my dental mirror, of course. Very quick check. I think it's all gone now, the plaque. Oh, look at that. Look at that. That's perfect. That's absolutely perfect. Your teeth look so nice and clean now. Let's double check the top as well. The top is fine, Very, very slight amount of plaque build up there, but not enough, I think, to warrant me going in with the metal tools today. We'll just keep an eye on that on the next visit, okay? Okay, that's excellent. Very good. I'm happy. I'm very happy with that. You can close your mouth now, that's fine. There we go. Fantastic. I think we're all done for today. Hopefully you found your dental checkup quite nice and relaxing. I don't think it was too scary today, was it? No. Let me give you some mouthwash before you leave today. Freshen up your mouth, make you feel a little bit better after all that cleaning I did, still, I can get it for you. That's absolutely fine. That's fine, okay? It's okay. It's nothing to be embarrassed about, you know? Get quite a few dribblers in here. Quite a few dribblers. It's natural. If anything, it's good. It's a good sign that you're producing a lot of saliva. I'd be more concerned if you had an excessively dry mouth. That's generally a bad sign. Generally a bad sign. Okay, here we go. Looking nice and clean now. Nice and fresh. Excellent. If you're happy, then I think that is the end of our dental appointment today. I'll see you again in 6 months' time, and I think generally you're doing very well indeed when it comes to your oral health. Okay, very good indeed. Nothing really to worry about. Keep doing what you're doing, and if you want to try and make some small improvements to your oral hygiene, the little things that I mentioned earlier, perhaps they could help you out a little bit, but that's up to you. Nothing to be concerned about or to stress about.